Hi, this is Yaz Dabol, live from SCAI 2019, and I'm pleased to be joined by Dr. Neil Wilson. Dr. Wilson, thank you so much for joining us.
My pleasure.
And congratulations on the Mullins Lecture that you presented earlier today. Before we began rolling today, I asked you what the lecture was about, and you told me it's about taking care of patients and taking care of yourself.
That's exactly right.
And do tell, can you expand a little bit more about that, on that?
Okay, well, I spoke about training, maximizing training such that you minimized any potential harm to patients when you were doing the procedures, and how you train juniors to take over more senior positions without putting the patient in any jeopardy. But I also spoke that despite the best wills in the world and the best training, you sometimes have suboptimal outcomes. The patient may be harmed, the patient may even die. And at that stage, that can affect you mentally, emotionally, more than you think. And it has, I know, put people off the specialty. People have dropped out of the specialty. And I think have suffered as a consequence of that. And I just talked about how to try and balance the two, and obviously try and make the positive side of intervention outweigh the negative side.
How did you actually address the taking care of yourself part?
Okay, well, I accepted that obviously some of our outcomes are suboptimal even with the best decisions. But I also said that we have to accept and acknowledge when we are successful and try and remember those good times. Parents will sometimes drop you a letter, send you a card, just shake your hand, say thank you. The kids themselves, just watching the kids grow, I if you like, featured several cases, several in particular I can tell you, of a pregnant woman who underwent intervention while pregnant because there were signs that her heart function were deteriorating and that the signs of good maintenance of the baby were jeopardized. Now that's a huge decision, because if things go wrong, we have the risk of 200% problems. And thankfully that particular case went very well. And so both mother and baby turned out fine. Obviously the baby stayed in utero, the mom's heart got improved, and the baby was born well, if somewhat premature. And that is a very positive feedback. We've made the right decision.
If, based on your lecture, if you want to give the audience one takeaway, one point, what do you think that point would be?
Keep training.
Keep training. That's nice.
Keep training. Listen to your friends. Make friends. Make friends with the important people, make friends with the people in the hospital who you work with, who might be helping you out of trouble if you get into trouble during a procedure, if you have a technical problem. And I've always prided myself on a good relationship with cardiac surgeons, anesthesiologists, intensivists, because we lean on them heavily. We work hard in the lab, and we rely on each other to have a good outcome for the patient.
How do you think overall the physician burnt out these days, and based on your talk, and training all the time, and at the same time taking care of yourself and taking care of the patient, how does physician burnout basically factor in, and how can we reduce that as much as we can?
Well, that's a good question, and really that's what I was addressing, because I had a junior colleague who, I don't think, perhaps it was a form of burnout, but for that particular colleague, the potential for negative effects of intervention outweighed any pleasure he was getting from the positive aspects. That's seeing the kids well, watching them run out of the hospital. And I thought, well, you have to emphasize, try and stay in straight on the narrow, try and understand that other people also have problems. It's not just you. And therefore, if you stay in the company of an organization like SCAI, you're going to meet peers people who are doing the same job as you. And if you say, well, I had this case once and this didn't go well, and somebody else says, well, I had a case like that a couple of years ago, isn't it terrible? You don't feel so bad. It doesn't feel so personal.
Do you think actually systemizing this friendship, making it part of kind of like a curriculum or like an educational thing where you emphasize friendship, is that something that would be reasonable in the future moving forward?
It's a good idea. I don't know how you put it in a curriculum. You know, some things are come easier to others than to some people. But all I say not just in a lecture, but I'll chat, look, you've got to make these people your best friends. You don't have to go out to dinner with them every night, but you've got to make them professional friends and understand each other so that you understand their work. And if you criticize it, you criticize in context and with positive feedback, and they the same with you.
Yeah. Well, thank you so much for your input, and congratulations again on the Mullins Lecture. And thank you all for joining us live from SCAI 2019.